Now, the World Health Organization has warned that repeating booster doses of the original COVID vaccines is not a viable strategy to combat emerging variants. The body has called for new specific jabs that can better protect against transmission. This according to an expert group created by the WHO. It says, and I quote, "A vaccination strategy based on repeated booster doses of the original vaccine composition is unlikely to be appropriate or sustainable." The group says there could be a need to update the existing vaccines. It says that development of new jabs will not only protect COVID patients from falling seriously ill, but also prevent people from catching the virus in the first place. New vaccines could also help lower community transmission and prevent severe disease and even death. The expert group calls for vaccine developers to create jabs that elicit immune responses that are broad, strong, and long-lasting. According to the World Health Organization, 331 candidate vaccines are currently being worked on around the world.
There are two concerns here, is that if we have a strategy in which we give boosters, let's say, every 4 months approximately, we will end up potentially having problem with the immune response, and the immune response may end up not being as good as we would like it to be. So we should be careful in not overloading the immune system with repeated immunization. And secondly, of course, there is the risk of fatiguing the population with the continuous administration of boosters.
Meanwhile, the UN Health Agency has not been pushing blanket booster programs worldwide. The body says that this is not an efficient strategy, as many people in poorer nations are still awaiting their first jab. So far, over 67% of people in high-income countries have received at least one jab. Less than 11% people have been jabbed in low-income countries. Well, for more on this, virologist Oyewale Tomori is joining us live from Ibadan. Oyewale, thank you very much for joining us. What do you make of WHO's warning that repeating booster doses of the original COVID vaccine is not a viable strategy to combat emerging variants?
Yeah, thank you very much. I think I agree with WHO on that because we are going to be getting different variants coming up, and each time a variant comes up, you keep charging people. Just like my colleague has said, you overload the immune system, and it is not sustainable to be jabbing people every 4 months. Even the regular immunization, we are not able to do it. Now, to make that additional thing of doing it every 4 months, I think is not sustainable. And I agree very much with the WHO over this matter.
Mr. Tomori, despite warnings that Omicron could infect more than half of Europe's population, people continue to oppose vaccinations. Who is mandated with enhancing public trust and is not doing his or her job when it comes to curbing the spread of the virus in Europe?
You know, I think the issue of freedom, my right, has become a major problem, in that part of the world. You discover that even though government is giving out information that is useful for them, they are talking about that individual right, which is overriding the public right. And I think time has come for people over there to realize that they are lucky, that they have the vaccines to be given to them, and they are not using it. There are parts of the world where there are no vaccines at all. They are waiting for vaccines, and people are talking about their rights not to get vaccines. So it's a matter of persuasion. I mean, you can't force people most of the time because they talk of freedom. We don't need to continue the persuasion to get the message out that the more you are vaccinated, the better for you. And it's your life that you're dealing with, not government's life.
Mr. Tomori, finally, what would be your advice as a virologist to some of these governments and some of these people who are really not happy with the vaccines?
You see, the point is that to look at what is happening in other parts of the world where the vaccines have been used, to look at the data. The people who have been vaccinated do not have serious illness. The people who have been vaccinated do not die, and not as much as what happens if you are not vaccinated. I think we need to get the data and show it to the people that when you are vaccinated, you are prevented from having a serious illness, and you are also prevented from having death. I think that message should be continue to be said out to everybody for the sake of it. Since they are more interested in their own life, then that message should be put out so that you are protecting your life by getting vaccinated.
Virologist Oyewale Tomori, thank you very much for your insights and for talking to WION.
It's my pleasure.
WION is now available in your country. Download the app now and get all the news on the move.